Anovulation. One of the most prevalent reasons of infertility is anovulation, which occurs when a woman's ovaries fail to release any eggs. Ovulation deficiency is usually associated with irregular periods, but sometimes bleeding occurs, which women mistake for menstrual blood. Anovulation symptoms. Anovulation symptoms include the following: increased cervical mucus production, temperature fluctuations, menstrual cycle irregularities. Anovulation causes and risk factors. There are a variety of causes and risk factors for anovulation, including the following. 1. Anovulation causes. It contains the following items. Using hormonal birth control. Some contraceptives contain a hormone group that prevents ovulation, while others contain progesterone or estrogen. Take some prescription drugs. Some drugs, such as the ones listed below, can cause ovulation to stop as an adverse effect. Nonsteroidal anti-inflammatory medications, NSAIDs. 2. Some natural medicines and plants. 3. Anabolic steroids. 4. Epilepsy medications. 2. Anovulation risk factors. It contains the following items. Obesity. An increase in body mass can lead to hormonal imbalances, such as elevated androgen hormone. Anxiety and stress. Anxiety and stress disrupt the levels of some essential hormones involved in the ovulation process. Excessive exercise may alter the pituitary gland's function, resulting in fluctuations in hormone quantities released by it. Prolactin levels that are too high. The hormone prolactin inhibits ovulation. Polycystic ovarian syndrome. This is a prevalent cause because it changes hormone levels in the body and raises male hormone levels. Anovulation complications. In addition to the symptoms that anovulation might produce, one of the most serious consequences that can arise from it is the inability to have children. Inovulation Diagnosis. Anovulation is diagnosed by doing the following tests. Measure your progesterone levels. Checking thyroid hormone levels in the blood. Checking prolactin levels in the blood. Ultrasound examination of the pelvis. The endometrium is examined. Treatment for anovulation. Anovulation can be treated in a variety of methods, including 1. Loss of weight. Losing weight is one of the most common procedures employed since it produces effective outcomes in the majority of cases, and it is normally recommended to lose 5% of one's body weight. 2. Get some medication. In addition to ovulation-stimulating medications, anti-male hormones such as the following can be used. Tablets containing clomiphene citrate. On days 5 to 9 of the menstrual cycle, 75% of women respond to dosages of 50 to 200 milligrams, and they ovulate with a pregnancy rate of 30%–50%. Metformin is a type of diabetes medication. When insulin resistance is present, this treatment is frequently used for a long period of time, up to 6 cycles. Injections of gonadotropin. Due to the increased risk of overstimulation of the ovaries and twin conception, this is started with low doses of these injections and gradually increased. In this approach, the rate of ovulation is 50% to 80%, with a pregnancy rate of 20% to 30%, and if this method does not work, in vitro fertilization or in vitro fertilization is used. Burning the ovary laparoscopically is another option. It was discovered that this sort of treatment improves clinical and biochemical outcomes, as well as the rate of normal pregnancy and pregnancy after medication treatment. Anovulation prevention. Because anovulation can be caused by a variety of factors, there are no obvious ways to prevent it.